It was the end days of July, the last 10 days, and I was busy preparing for the campaign in Ramadan, which was going to support numerous projects around the world of Muslim charity, including a welfare complex in Somalia. And then the reports started coming through of the torrential monsoon rainfall and the damage it's causing and the potential flooding.
When a mother travels on a tanga or a camel cart or a ghora or a horse cart to deliver a baby and go to a city hospital by traveling 20 miles, that concerns me.
We are still taking care of our orphans. You know, we are educating them. It costs about £30 a month to take care of their every need by the grace of Allah. Be kind to the people here so that the Lord is kind to you.
This is a story of how one country is standing strong through many shocking realities. The devastating monsoon rainfalls of 2010 are iconic images of Pakistan's recent history. Yet, there are many issues facing Pakistan, a country that has 64 million people under the poverty line. The people of Pakistan have been affected in so many ways, it's unimaginable and at times difficult to comprehend. These people, though, are not alone. They are being helped through this difficult time. The following set of stories will show a glimpse of just how this huge and complex task of rebuilding is taking shape.
Muslim charity started off in Pakistan. The trustees and the chairman belonged to Pakistan, and they were really looking to resolve the problems which they understood well in a society which they understood better than other societies in different parts of the world. One of the first operations was to start sponsoring orphans and start providing water facilities, and it's been that day in '99 and today, alhamdulillah, 12 years later, and it keeps on growing from strength to strength.
The uniqueness of Muslim charity is the projects. I think there are very few organizations who are working in maternal care, and Muslim charity is one of them. Almost every year Muslim charity is establishing one gynae hospital by looking the needs of the maternity around the world. This was the main key projects of Muslim charity, to look into the maternal care, and that's the reason why Muslim charity has built its first hospital in Jhang, second hospital in another deprived area of Faisalabad, third hospital in a sub-district of Jhang near Mangani, fourth hospital in Azad Kashmir after the tragic earthquake of 2005, and the fifth hospital in the main city of Lahore.
As the government hospitals are overcrowded and they cannot cater so much of the population, as the population rate has grown high in last 5-10 years, so the private setup has to work on those bases. We have a basic infrastructure which is providing emergency gynecological obstetric services and to deal with any emergency at any time in those hospitals.
Not most of the people understand that they have to come to the hospital and they need to be in touch with a gynecologist for a longer period of time, so that they could monitor their pregnancy, and they could monitor if there is any complication during that period. So a lot of women just they're not that knowledgeable, so they generally spend most of the time in their houses, and where they go through these situations, and if there is a complication, then those complications are not small complications. When they go through a complication, it's a huge complication, and the whole case is in a very bad shape by the time it comes to the hospital. So that is one of the biggest problems that we are facing.
The Jung district is amongst the poorest areas of Pakistan, and after realizing the dire need of this underdeveloped and impoverished area of Pakistan, the land for the proposed gynae hospital in Jung was approved in October 2003. After a short span of 20 months, in 2005, this gynae hospital opened its doors to the community and has been growing from strength to strength ever since.
Young hospitals, they were built in the rural areas basically, which are lack of government services, and private healthcare services were also not there. And there was very high incidence of maternal and child deaths over there. We have opened our 25 bed hospitals which are 24-hour open there to provide basically gynecological services, so that the deaths and complications which rise during the childbirth at home should be reduced, and they should be given high quality services over there. In Jung Hospital last year we had 1500 deliveries of newborns, and alhamdulillah all went fine without any infant or maternal deaths.
मेरा पहले एक बच्चा है, दूसरा बेटा पैदा होया, बड़ा अच्छा अस्पताल दामन करेंगे हैं भाई, डॉक्टर साहब बहुत अच्छी है, मैं बहुत खुश हूं, अल्हम्दुलिल्लाह, शुक्र है अल्लाह से मेरा दूसरा बेटा होता।
The idea was very simple. It was to provide safe and affordable and even free facilities to those who simply could not afford it, and to tackle the sheer lack of suitable facilities in that area. The locals in the areas, they tell of stories that mothers-to-be would die while they were being moved from their homes to hospitals in search of facilities, trying to give birth. Mothers would die en route, and it's that simple reason why the Charities Hospitals was established, to help those people who are in most need.
The hospital in Jung is not the only running facility. From the 5 hospitals built so far, this gynae hospital in Lahore was the last to be built, serving hundreds of patients. It stands tall as a pillar in the community. Major Saeed has been here from the very beginning and has witnessed the progression of this hospital.
The people in the surrounding area are mostly the people who have migrated from their own areas, and they are working in these factories. Since this is an industrial area, so the people are working in these factories on the daily wages basis, and they are earning not more than 200 rupees a day. And in this case, in today's environment, once the medical facility is so expensive, they are unable to afford that. So in connection to that, once the Muslim charity has created this opportunity for them and this facility for them, they have enjoyed it. They are coming to me and they are appreciating all the things which are being done over here.
Dr. Iram Shahzadi is the senior doctor here. She is responsible for making sure her team provides the best possible care to their patients.
We have a very comprehensive health program here. A comprehensive means a complete health program for male, female and children. There is no discrimination between male, female or any age group. We are providing not only examination, but we are also providing a free medicine to the patients. We also have X-ray facilities and ECG facilities for the patient. We have a very well-equipped operation theatre and a labour room facilities. Our labour room is also very much equipped with instruments and sterilization.
बहुत अच्छे डॉक्टर हैं इधर के, हमारे मोहल्ले में तो बहुत सुकून हो गया है, बहुत ताउन करते हैं, बहुत अच्छे हैं। मैं इधर से बच्चों का इलाज करवा रही हूँ। अब तक मैं काफ़ी टेस्ट करवा चुकी हूँ, ये पेशाब टेस्ट, खून टेस्ट और वो अल्ट्रासाउंड बहुत अच्छी करते हैं, बहुत मतलब आराम से बहुत अच्छे तरीके से कर रहे हैं।
Temina was suffering from vomiting during her pregnancy, also known as antenatal vomiting. She is very pleased with how the hospital has been looking after her.
मुझे मोहल्ले से इत्तला मिली थी कि ये हॉस्पिटल बहुत अच्छा है, आप भी जाएं, सहूलतें भी बहुत अच्छी हैं, सस्ता है। जब मैं यहाँ पे आई तो सब बहुत अच्छे थे, डॉक्टर स्टाफ सारे बहुत अच्छे थे, दवाई भी सस्ती मिलती है, अल्ट्रासाउंड भी अच्छी होती है, डॉक्टर बहुत तसल्ली से काम करती है, बात बहुत अच्छे तरीके से सुनती है, टेस्ट भी बहुत अच्छे होते हैं, सस्ते होते हैं।
Not all patients live a stone's throw away from the hospital. Although they live within the vicinity, Gul Khan often has to walk a considerable distance to the hospital with his two younger brothers. As well as doctors, the hospital ensures patients are looked after by their nurses, taking care of the patient's every need. Imtiaz Bano was one of the first nurses to join the team.
Muslim Charity called me for an interview. When I came here, I realized how much people are in need. This is why I'm here, to give them my time, to help them. In the beginning, I faced many problems because this area was quite far from where I lived. But I'm happy now. The organization has given me great support.
150 kilometers west of Lahore is the city of Faisalabad. After the huge success of the Gynae hospital in Jung, this hospital in Faisalabad was the second to be built, opening its doors to the public in May 2007.
If you look at the surrounding area, there is a huge requirement by the people to have the specialist gynae hospital. So that was the main idea behind it.
Muslim Charity Gynae Hospital Japal Faisalabad 25 बेड पर मुश्तमिल हॉस्पिटल है और इसमें मेडिकल स्टोर, लेबॉरेटरी, एक्सरे, ऑपरेशन थिएटर, लेबर रूम, अल्ट्रासाउंड की सहूलत मौजूद है और इसके अलावा हमारे पास सीटीजी की सहूलत मौजूद है जो हमारे अलावा एक हॉस्पिटल में और में मौजूद है।
होम डिलीवरीज का ज़्यादा यहाँ पे रिवाज होता है गांव के एरियाज़ में। तो पहले यहाँ पे इन्फेंट मोर्टेलिटी रेट, मैटरनल मोर्टेलिटी रेट बहुत ज़्यादा होता था, लेकिन अल्लाह का शुक्र है जब से यहाँ पे ये सेटअप बना है उसके बाद से ये बहुत परसेंटेज कम हो गया। हमारे सेटअप में अल्हम्दुलिल्लाह आज तक ये मैटरनल मोर्टेलिटी का कोई केस या इन्फेंट मोर्टेलिटी का नहीं हुआ, ठीक है, क्योंकि यहाँ पे प्रॉपर टाइमली हम लोग फीटल डिस्ट्रेस को भी टाइमली मॉनिटर कर लेते हैं। सीटीजी हमारे पास है, सोनिकेट की फैसिलिटी है, तो उसकी वजह से हम लोग फीटल डिस्ट्रेस को भी टाइमली मॉनिटर कर लेते हैं। और इसके अलावा एमरजेंसी बेसिस पे एनेस्थीसिया की फैसिलिटी है तो सर्जरी भी हम जल्दी अरेंज कर लेते हैं, वो भी प्रॉब्लम नहीं होता हमें।
हमारे पास यहाँ पर डेली के 60 से 70 मरीज़ रोज़ाना चेक कराने के लिए आते हैं, जिनमें से 4 से 5 एडमिशन्स होते हैं डेली के ऑन एन एवरेज। तकरीबन जो है हमारी नॉर्मल डिलीवरी सिजेरियन सेक्शंस मिला के लास्ट ईयर हमारे 1500 के करीब हमारी एंट्रीज थी नॉर्मल प्रोसीजर्स के लिए, जिनमें सिजेरियन सेक्शंस भी थे और नॉर्मल डिलीवरीज भी थी। लास्ट मंथ में हमने तकरीबन 80 to 90 हमारे प्रोसीजर्स हुए हैं, जिनमें सिजेरियंस भी थे, तकरीबन 30 के करीब सिजेरियंस थे और 50-60 नॉर्मल डिलीवरीज थी। और चूँकि जंग के काफ़ी सारे गाँव और बहुत सारे इलाके यहाँ पर हैं जो कि इस हॉस्पिटल के हमें नज़दीक आते हैं, तो बहुत सारे दूर दूर से लोग यहाँ पर आते हैं। तो कल के ही दिन में हमारे 10 केसेस थे जो कि हमने किए हैं, जिनमें से हमारे 7 नॉर्मल डिलीवरीज थी, 2 सिजेरियन थे और 1 हमने डीएनसी का किए थे।
Things are getting better as far as the medical facilities are concerned. You do have facilities, yet there is a dearth. There is a dearth, but then there is a dearth of medical facilities even here in UK. You know, you need medical facilities everywhere. So I personally feel, to tell you the truth, I just feel that you just have to play your own part. You know, one man can just absolutely not create a hospital in every city in the country. You just try and play your part, and things are getting better. I'm not saying there is no dearth of it. Things are getting better, but Muslim Charity will, inshallah, play its part.
Muzaffargarh is a district in the south of the Punjab province. Spreading over an area of just over 8,000 kilometers, it lies in the strip between the rivers Chenab and Indus. Ehsanpur is a village in this district and is the location of this new construction of 150 houses.
After the tragic floods of 2010, millions of people lost their houses, their belongings, their crops. They did not have anything left. They were living in the shelters, temporary shelters, like tents.
Muslim Charity then decided to come over here. We have surveyed the place and decided to construct the modern village. It's state-of-the-art, a new modern village design that we are going to deliver. This is basically a mega project of 300 houses that we are actually building here. Hopefully we will finish this project by the end of this month.
It's a painstaking experience, I must tell you, because you have to first clear the grounds, in which there has been devastation. And the ground has to be leveled. Then you have to either see a new area, and then construction is done over there. And then what you're trying to see is that if you now that you're constructing something on a totally new level, then the construction should be a notch above what was already there. So in this aspect, I think it's very interesting, yet very challenging.
These villages are helping to shelter those people, those adults, those elderly people, and those children who otherwise would still be sleeping under the open sky, exposed to the elements, to the winter and to the harsh sun. The villages will greatly help those, and for these people it's a facility that they could not even have probably built in their own lifetime.
After the floods, we didn't have anything to eat. We had to go to different places to get help. Sometimes people would give us some food. We faced many difficulties.
When the floods came, we were caught by surprise. Our house and belongings were taken from us. We have been without a house for 3 months. We are thankful to these people who are building new homes for us. At the moment, we are without houses and have come here to help with the reconstruction.
Charity organizations here liaise closely with official relief departments, working through a joint effort in delivering aid to those who are in need. This is the Relief and Crisis Management Department for the Government of Punjab. Khalid Sherdil leads the team here and liaises with various NGOs working for the humanitarian cause.
Muslim Charity has a hands-on approach at grassroots level, where they are the first ones to come, raise donations from all over the country and worldwide, courtesy or donors like all of you who come from overseas to help their Muslim brethren back in Pakistan. The other thing about Muslim Charity is that they have a complete infrastructure of their own contractors, their own logistics. They have full-time staff working here in field of health, in field of logistics, relief. And this helps us in the sense that when other NGOs come, a lot of them are dependent on us. But Muslim Charity is very self-organized and they come to help us.
This is Kotmitten, a small city in the area of Rajanpur, with a modest population of 17,000. This area has been chosen for a brand new development, a modern village consisting of 400 houses.
I remember visiting the areas of Kotmitten after the floods, some month and a half after them. The only term I had in my mind was devastation. It was complete devastation. The mud houses that they had, even some of those which were built of bricks, they were down to the ground. There was nothing left. Absolutely nothing remaining. People were sitting under the open sky.
We have started some model villages with the facilities of everything in that, which facilitate not only the houses but also the community services like the mosque, cattle yard, clinic, markets, play fields for the children. And their houses are equipped not only with the water facilities and sewerage system but also with solar lighting.
बहुत अच्छा काम हो रहा है। हमारे तो ज़िले में जो काम हो रहा है ना, ये आपकी चैरिटी काम कर रही है, हम तो बहुत बड़े खुश हैं एक तो गरीबों में रोजगार खुल गया, जो हम मजदूर लोग हैं, जो दूसरा जो गरीब लोग हैं जिनके पास मकान नहीं थे या बना भी कभी नहीं सकते थे, उनको मकान मिल जाएंगे, सारी उम्र आपको दुआएं करेगी।
Aladat Amir is the social coordinator for these projects. He liaises with the site engineer, ensuring that these new developments are in line with the needs of potential residents.
They haven't forgotten about the flood-affected areas. They have been with the people every step of the way. These 36 houses are not just homes, they have been given a boundary wall for safety. There are also plans for a park and vocational centre. For the children there will be computer facilities, giving them a good start in life.
एक कंप्यूटर का भी इंतजाम कर रखा है कि ये बच्चे जो है ना एक अच्छी जिंदगी की शुरुआत कर सकें।
Amir Bibi lives with her 3 grandchildren. Her home was destroyed by the floods. She was the first person to receive a newly constructed house.
When the floods came, we had to stay for many nights at the station. We didn't know where to get food for the children, but we had to stay put. There are still so many people who need homes here. They are praying. They have little children, some of whom are ill. I am grateful for what I have been given and pray that others also get homes too.